Hello, I'm William Canty.
I'm Sophia McCrae.
And I'm Gloria Johnson.
Today, we will be discussing the current state of accountable care organizations, or ACOs, integrating care for substance abuse with primary care settings.
You may ask yourself, what are ACOs? The Accountable Care Organization, or ACO, concept is one that is still evolving today, but it can be generally defined as a group of healthcare providers, potentially including doctors, hospitals, health plans, and other healthcare components, who voluntarily come together to provide coordinated, high-quality care to a population of patients. The goal of coordinated care provided by an ACO is to ensure that patients and populations, especially those with substance abuse disorders, get the right care at the right time and without harm, while avoiding care that has not proven benefit or represents an unnecessary duplication of services.
So, how can ACOs transform healthcare? As healthcare providers organize as accountable care organizations and assume responsibility for the total cost of care and health outcomes for their patients, successful providers and payers alike are implementing strategies to improve the underlying health of the population served. This emerging focus on addressing the needs of a defined population, as opposed to those of an individual patient, is reflected in the development of population health management, or PHM programs. These programs are commonly delivered by an ACO and its community partners, informed by an assessment of the risk and health needs of the populations, and supported by reformed payment and claim data from health plans. What is the impact of substance abuse in healthcare? Substance abuse refers to the harmful or hazardous use of psychoactive substances, including alcohol and illicit drugs. Psychoactive substance use can lead to dependence syndrome, a cluster of behavioral, cognitive, and physiological effects that develop after repeated substance use and that typically include a strong desire to take the drug, difficulties in controlling its use, persisting in its use despite harmful consequences, a higher priority given to the drug use than to other activities and obligations, increased tolerance, and sometimes a physical withdrawal state. Nearly 21 million people suffer from a substance use disorder, and only 1/10 receive treatment.
So, how can substance abuse patients potentially benefit from ACOs? Over the past several years, ACOs have been transforming their clinical and financial infrastructure to improve care quality and reduce costs. Substance abuse programs with higher financial risk can decrease spending for post-acute care. Using care coordinators to help patients navigate to post-acute care after discharge helps succeed in lowering healthcare costs. The ACO model is maturing, and how it will impact the healthcare industry is yet to be seen, but the work currently being done to coordinate care and improve quality has already had a significant and lasting impact on healthcare delivery.
Integrating ACOs into substance abuse treatment organizations. SAT organizations, or substance abuse treatment organizations, are more likely to participate or plan to participate with ACOs in states with Medicaid or Health Insurance Exchanges, or HIEs. HIEs are organizations that mainly serve individuals who own small businesses with insurance. ACOs are able to effectively participate with SAT organizations because the Affordable Care Act requires Medicaid and HIEs to cover substance abuse treatment. The extent of integration of ACOs with SAT organizations depends on the insurance coverage the individual has. This dependence on insurance coverage comes from the goal of ACOs to provide care at decreased costs with a source to cover their costs. Effectiveness of ACOs in primary care settings. ACOs in primary care settings utilizes licensed clinical social workers to aid in initial referrals for short-term concerns or behavioral health resources. ACOs are making a change in how treatment is delivered for substance abuse patients by integrating mental health providers and emphasizing the healthcare team-based approach in primary care. Traditional healthcare consists of medical professionals and emphasis on seeing specialists. In contrast, ACOs embrace the gatekeeper approach by not only emphasizing a primary care approach, but also including clinical social workers as a part of the medical care coordination. Discussion questions. What are the drawbacks of requiring patients to have insurance coverage in order for a substance abuse treatment organization to participate with an ACO?
2. In regards to healthcare costs, how much variation from the standard protocol or care should care coordinators allow for substance abuse patients? Thanks for watching.